Hello, everyone. My name is Wayne Tucker, the host for the Infection Control Exchange, and the focus of this episode today is going to be on inspection and compliance. For example, when the ministry shows up for a long-term care home, we'll go through kind of like the process. Explain that first. They could show up anytime, but usually they show up in the morning. When probably say between 9 and 10. Often they're traveling, so to get to a particular home. Um, and they could show up, a number of inspectors could show up, could be one person to start and could go up from there. It could be 2 to 3. We've seen up to probably 4 or 5 inspectors in the home at the same time. So, there's no and the reason that they could be coming into a home could be to follow up on an outbreak, but they could be coming into a home to follow up on, um like a complaint, as well. So, a number of reasons why they may actually enter a home. But make it clear that once they've entered the home, um, infection control, uh, measures or evaluations on the table. So they're gonna be looking at anytime they come in, they always look at IPAC, so infection prevention or control. And no matter what the reason that they arrived at the home. So it's very important to realize when they're there, infection control is always being looked at. So, um, want to talk about the first impressions because I think it's very important and it is my approach, the way I did it when working in long-term care, is take opportunity once you know that the ministry inspectors are on site. They're going to be set up, for example, in a designated room. Usually, there's a sign on the door, for example, to knock, um, in case they're having a private conversation with somebody or interviewing. Um, so you go through. I will, as soon as I find out the ministry is on site, I'll take a couple minutes to go down to wherever they're set up and introduce myself to them. So I tell them that I'm the infection prevention and control manager, um, and give them my information, my phone number or extension that they can call and reach me, and I'll explain to them I'm available at any time to talk to them and give them my location. So where am I located in the building? So you want to give all that to them. It's important, in my opinion, to um, have that first connection with with inspectors, to set up that kind of relationship. So don't try to be avoiding connecting with the inspectors. They're going to meet with you, um, and I think it's better to go and be proactive and introduce yourself to them and get to know them a little bit. And then when they're ready to interview you, they'll come and get you, or they'll see you, in the building. They'll say, "Okay, Wayne, we're ready to do the interview with you now." Go through the interview process a little bit. I want to kind of give you some details there. So once you'll go into a room. Like I said, it's just usually, my experience has just been one inspector doing the interviews. So you sit down. Obviously, they're going to have a lot of questions. You don't know what the questions are, but you're going to just answer the questions the best you can. Um, and in Ontario, the process was they recorded all the meet interviews. So the first thing they do is set up their recorder like on their camera or their laptop, and they'll do a little introduction for themselves and time and what home they're at. So a bit of their setup for their documentation on the video, and then they'll ask the person that they're interviewing to introduce themselves. So you're going to do that, and then they'll ask you a series of questions. So, um, in my experience, some of my interviews have been like um, 10 minutes, and my longest one has been about 90 minutes. So it can vary in time for many different reasons. there's different types of inspections that they could be coming in to do. Um, so there's many reasons that could be why the duration may change. But one thing's for sure, you will be interviewed. They will be coming in to or coming to speak with you. So like I said, you want to create that a good impression right from the start. So um, a few other things is if you're in the interview and they're uh, they're going to be asking you for a number of different things. So if you're not sure about something, very important not to just to guess at it. That's not going to be very beneficial because it's a recorded session, and then they have that audio documentation of your interview, giving inappropriate information or wrong information to them. So it's very important to obviously take it very serious. And if you don't know something, then just say that you're not clear about that, but you'll look into it and get back to them. The other thing I wanted to start with, just remembering is not to panic. So this can be very difficult for the staff and for the leadership team, but I think we have to emphasize that the importance of just trying to stay relaxed with it. They're coming in for a particular reason. It's an important reason that they need to follow up, whatever reason is a complaint. But like I said, they're going to be looking at IPAC. So, but still, the process will go much better if you um, remain relaxed. Your interview will go better. Um, the whole process will go better. Like, don't take it. Sometimes people take it very personally, these inspections. But these inspectors for long-term care, for example, were hired for a particular purpose. They're looking at all for Ontario, looking at the operations and entire process of a long-term care home for quality care for residents. So, you got to think about it from that they're there for a reason and they're there for a very important reason. So you want to help them as much as possible. So, like I said, I mentioned, you're going to be I don't think there was, um, I'm sure there's not one time that the ministry came in and did an inspection where I wasn't interviewed. So I was always interviewed as a as a manager for infection control. So just relax. It's you get the first time. For some staff, it might be a bit of an experience to get used to, but just relax, answer the questions as best you can. Like I said, don't go guessing or making up answers or anything like that. If you're not sure about something, then you can always say you just get back to them. But once they arrive, we'll go a little bit more deeper into to the interview. But it could be any questions that they could ask. So um, it could be anything about an outbreak, recent outbreak. So, like I said, it could be coming in and look at a complaint, but they want to interview me, so they'll ask me about infection control. They might talk about a recent outbreak that was open and or was open but it's now closed. The outbreak could be 6 months ago. You're going to have no idea. You're just going to have to answer the questions, and they'll ask for like some document, a number of documents. So you're going to provide that to them as quick as possible. So it could be, a copy of the line list. So who's actually was uh, put on the outbreak. So that could be for staff and residents. So you're going to provide that information to them. It could be information about audits. So, they might want some documentation about what anti-hygiene and PP audits you've been doing on the floor. It could be questions about eye touch disinfecting. So, have you been doing your eye touch, especially during an outbreak? So, they'll get into all the details of, for example, in this case, an outbreak. So, you'll answer all those questions during the interview, and then sometimes there could be a follow up interview. They'll record that as well, but and you could see them once you've done the interview. Or you're going to see them on the floor, so they might have questions when you're on the floor looking at things for yourself for an infection control manager. So you'll answer those questions as they come up, and as you see each like new inspector come into the home, you want to introduce yourself to those inspectors coming into the home. Um, One of the things I want to talk about is the documentation that you need to provide. So there's going to be, like I said, a fair bit of documentation that you need to provide them. So you want to keep that information very organized, because almost like you're planning for the ministry to come in and do their inspection. So um, you want to keep all your files very organized, because some of my interviews have occurred actually in my office, and they will allow you to uh, check your computer and provide the documentation rather than printing it and bringing it down to them. So sometimes it works out good to do the interview in your office, because you can quickly bring up the documentation that they're requesting on the computer and then just show them. Um, Sometimes they'll take images of certain things, but nothing like would in this case, nothing with resident names on it or anything like that. So, but I'll give you an example. They took pictures of our outbreak plans or our own specific outbreak plan. They took images of that, and then so it's very important to work on that. It's I guess, kind of two phases that I kind of look at it when they come in is, you know, gathering after your interview, I should say, gathering that evidence that they're looking for, so that documentation that they're looking for. So you want to be providing that as quick as possible, in a timely manner. They don't want to be waiting 2 days or 3 days to get something that they asked you for. And I mentioned at the beginning, sometimes or some of it they want it right away, within the first hour. Okay. Some of that could be, for example, who's on precaution. So how many residents do you have on precaution on each of your floors? And part of the infection control information is that you got to make sure that you keep all that very current. They don't want to see a discrepancy between, let's say, what nursing is saying, who nursing has on isolation precautions, and who's on precautions according to the uh, infection control manager. Uh, as well, they're going to check the EMR and see if everything this match is aligning. So is what the IPAC manager is saying, who's on precautions matching up with nursing, and is that information matching up within the EMR for the residents, and is it matching up with the care plan for the residents as well? So there's a lot of things they're looking at um, to see if we've got everything in order, um, and rightfully so. So if I say we only got 10 residents on precautions, and nursing says we have two more, that's not good. And then if the EMR is a different number, again, it's not good. So that's why the process is so much important even before the ministry arrives within your home, is to make sure that you've got all you're doing everything that you're supposed to be doing. You got all your protocols in place, and you're following them. Then when the minister arrives, there really is no reason to panic, because everything that you should be doing daily, you're going to do the same day as when the ministry arrives. So you're going to do the same thing, and the process is not going to change. The only thing is, now you have someone else on site just kind of looking things over. So that's why I really try to emphasize the importance of for the staff not to panic, relax. It may not be an enjoyable process, but you'll get through it. Just answer the questions. If you're not sure about something, check with someone. Don't go be guessing answers, and the process will go fine. Um, the other part is like you're going to be working on is because when they're there, especially the first couple of days, it can be quite busy for any department, whether it's nursing or infection control, because you're going to be working on getting that initial rush of information or requests. So you're going to be working on that. So important for you to get that documentation. I can't stress that enough. Get that to them as quick as possible, because in my opinion, if you make them wait, um, I think it can change the relationship. So it's important to get that to them as quick as possible, so that you have a good relationship, and they see that you're very organized. Because if they, um, I think, in my opinion, if they see someone at home where they're struggling to provide the documentation, I think that doesn't show good in terms of the protocol. So in other words, I think it comes across that you don't have all your all everything in place and functioning smoothly. So when you take 2 days to get them something that should only take, you know, 5 minutes or 2 minutes to get it, I think it creates that kind of suspicious atmosphere for them, and they're gonna likely dig deeper as to, like, why is it taking the IPAC manager, all day to find this information for me? So can't stress enough, work on the documentation, get it to them as soon as possible, and the inspectors will be happy. You might be dealing with a number of inspectors. I mentioned at the beginning, inspectors are gonna come in, um, at different times. Usually, sometimes 1 or 2 shows up. So you're gonna introduce yourself a number of times to different inspectors as they come in. The other thing that's gonna keep you busy for an infection control perspective is that you're gonna be, on the floor probably more than usual. Again, all the IPAC measures, everything that should be done, should be should be in place, but you're gonna wanna make sure, right? You're not just gonna assume you have the ministry on site doing their inspections. You got a lot of, eyes looking around, so you're gonna be on the floor, just going from floor to floor, especially for the first, couple days on a pretty regular basis to see, what you can find, right? You wanna make sure that if you see anything, that you're fixing it as quick as possible. So you're just gonna go from floor to floor. Like for myself, I'm looking to make sure that my database of people who's on isolation precautions is matching with what's on the door on the resident door. So if I say there's 12 people in the building on precautions, then I'm going to make sure that all those rooms, those 12 rooms, that everything is in place because things change during the shift, and you want to make sure that everything's in place. So you're going to check all those rooms, and I've mentioned it on another video, but you're going to go check that signage, make sure the right signage is up on the door. You're going to make sure there's a donning and doffing sign there, the donning being on the outside, the doffing sign being on the inside. You're going to make sure that there's a PPE bin there with all the PPE they need. You're going to make sure that there's obviously their hand sanitizer pumps are there, but make sure there's a doffing bin inside. So you're going to check all those things as you're going through the floor. And you're just going to go once you get that part done, but as you go from floor to floor to check on all those things, you're going to see what you can find, right? Talk to the staff, see if they're having any issues with anything, and resolve them. Because last thing you want is is one of the staff to have issues with something, and then they don't feel like that you're listening to them, and it hasn't been addressed, and then they bring that up to an inspector on the floor. So the inspector may say, is everything going okay? And they say, well, actually, no, we're having this problem. So you want to get on top of that and deal with those issues up front as soon as ar- as soon as you get there, as soon as you arrive and you've done your initial introduction and stuff. The interview could be anytime. You're not going to know when your interview is. It could be the first day, it could be 2 days, it could be 3. No way to predict it. So you're going to spend a lot of time on the floors just checking on things. See what you can find. Um, and you're there also on a bigger issue of representing the home. So, it's not just IPAC. If you see any issues, you want to be working towards resolving them. So that include a spill on the floor or anything for health and safety risk. You got to also take it from kind of like a perspective of the home. IPAC's usually part of the leadership team, so you're representing the home. So you want to make sure that you're taking care of other things that you might see as well. Right? A resident could be asking for something, so you want to be supporting the residents because, again, for the reason that you should be doing that anytime. You should be always be helping out the residents, not just because the ministry might be coming down or be on your shoulder, something like that. Well, it's right. You should be doing all those things that you need to be doing to support the residents. You should be doing that regardless of what the ministry is in. But it's going to be back in your mind that the ministry is there, and sometimes it's a little hard to get away from that a bit. So you want to be increasing your rounds and stuff like that. You want to be doing those huddles, um, and you know that type of thing gets noticed by the ministry. For example, if they say went into a home and it's like you're never seeing the infection control manager, they've been here for several days. There's several inspectors there, but we never see Wayne. Well, do they have an infection control manager? So that's why the presence on the floor is so important. You want to be seen there. You want to be seen that you're checking on things. And I guarantee you, they will notice. They will notice that you're there filling in those gaps. And um, from my position, it was a management position on the leadership team. So it's important for you to be, fill in those gaps that you see. So if you see things are missing or not set up right, you're not just going to ignore it and leave it and wait for someone else to fix it. Some things you're going to need some help with, um, from an infection control perspective, and then some things you're just going to take care of it yourself, right? Um, but you're going to be going from floor to floor. You're going to be checking in with different people. You're going to be checking in with the DOC, the administrator or executive director. You're going to be checking in with quality and environmental health. So talking to the housekeeper, you're going to be asking them about eye touch. So when you're on the floor, you're gonna be talking to the staff and, like I mentioned earlier, seeing if they have any questions that you can answer. Okay, so you're going to be doing that several rounds a day, going from depending on the layout of your building, whatever floors you got. You're going to be going through and just checking on everything. You're going to be checking on your surveillance documentation, your monthly surveillance for infections. You could be asked about that. Um, you could be asked about providing documentation on your 24-hour surveillance as well. So make sure that you have got that all up to date. And there's, like, for example, there's no missing forms. So the last thing you want to do is see a binder with the surveillance forms, and there's no surveillance forms in there, for example, right? So you got to be looking at everything, as well as looking into EMR. So you're going to be in your office as well, but try to do those things as quick as possible, and try to be on the floor as much as you can, answering questions that the inspectors might have, um, and getting that documentation that I mentioned earlier. Every interview for myself has been different. There was some standard questions they would ask, and then some of those standard questions later on dropped off and weren't asked anymore. So, but you're never gonna know what they're gonna ask about. You're gonna have minimal information. It could be, like I said, mentioned, they could be coming in for a particular complaint, but it doesn't matter. They're going to be interviewing IPAC for sure. Every visit, I was interviewed, and I mentioned earlier the time varied, but I was never skipped for an interview. I think one time I was away for a couple of days there, but, and, they said, they're fine waiting until Wayne comes back, to be interviewed, and that was it. As soon as I came back, there was no delay. Like, as soon as I knew that the inspector's on site, I went to introduce myself, and I'm pretty sure I was being interviewed within 30 minutes to answer those questions. So you know, it can be a long process. The other thing I want to mention is that, um, like, the number of inspectors will vary in terms of how many inspectors are going to come up. It could show up sometimes, especially in the first couple of days, different times. Um, so you got to get used to that. It's going to be different inspectors you're going to be speaking with. The other thing is the duration. Um, the duration is not short for a lot of these inspections. So I'm sure every province or in different countries and stuff that have inspections, the duration, in this my example, Ontario, Canada, um, it could be a few days. I don't think I saw one that was less than a week, but they went for, I think, like, seen them up to go 3 weeks or more. So sometimes they could be on site for what seems like a very long time, and it is a very long time. For example, if you got 3 inspectors on site for, 3 weeks, that's a lot of ministry, inspectors visiting the home, go through their, process, right? So that can vary a lot, but you just gotta remember not forget that they're there. I mean, you should be doing everything that you should do, for example, for infection control, you should be doing anyway. Um, but you don't wanna be complacent and forget that they're there as well, right? So you wanna kinda little heightened surveillance for yourself and your IPAC measures to make sure that, everything is right. And then the more you do that, the less issues, that are gonna come up. So be on the floor, talk to the staff, answer all the questions, and we'll get into the next segment. In the next segment, I want to get into a couple issues. Well, mainly one is how you respond to the inspector. So it's really important to be careful during the inspections um, that you don't get defensive. Because that's just going to make things worse if you're challenging, I guess, the inspectors on every question that they're asking. So, and kind of getting defensive. And you just got to be careful of that and watch for that you're not doing that. Um, it can be difficult because over a number, like a week, 2 weeks, 3 weeks, you're getting like a lot of questions coming at you. And that could be, at times, may feel overwhelming. And it's your program, like you're responsible for the program, infection control, for example. So sometimes it's easy to take that personally when it's almost like you may feel like you're being attacked, I guess, and not doing a good job with your work. So please just think about that. Be careful of that reaction um, when inspectors are on site, because if you react like that, it's going to make things worse. It's not going to make things any better. Um, it- it's- so you just got to be careful of that. don't take it personally. They're there to do their work. They have to check on the homes, the complaints, for example. They have to check on the infection control program, what's happening with that. So like I said, just go through the process, answer the questions, but just be careful of your emotions when they're on site, and keep that in check. Make sure that you're not, like I say, getting defensive of every question that they may ask you. So another area that I want to get into is the finding. So after they've finished everything, they have a particular report style that they do up, and then there'll be findings that come out of their inspections. So they'll meet with depending on the title, for this case, a long-term care home, an administrator or an executive director for the home, and they'll go through, findings, and then there'll be an official report that will be sent out later. But before they leave the home, they do an exit interview, and then in that interview, they'll go through their findings. So their findings, and at least for, any province, it could be different in Canada or any other country. But in my example, their findings are put into two different categories. So they have one that's still very important, but less severe, what's called a written notification. So they'll put that in their findings, and that could be any issue. It just didn't warrant the next classification. So it still needs to be taken seriously, and you should be working to fix those issues. But where the real weight of their findings comes is what's known as a compliance order, or CO. So those are more serious. And if you're issued those, you got to develop action plans for how you're going to resolve it. So let me give you an example. So if they saw, trying to think, one situation was if they saw staff not wearing their masks or not wearing a mask appropriately, and they witnessed that, usually multiple times, then they could very much write up a compliance order for that, for those staff to receive additional IPAC education and training. So what will happen is you'll get those compliance orders. It could be several of them, and you will design or develop an action plan for each one of those compliance orders, and it has to be very detailed, and the record keeping has to be spot on, because the ministry will be coming back to look for that documentation, to prove that you've taken it serious and that you've taken the steps to fix the issues that they've identified. And they certainly will not be very happy if they came back and only to find out that you didn't take it seriously or not take it serious, and resolve the situation. So it's very important to take it extremely serious, develop those action plans very quickly, get them in place very quickly, and you need to monitor it. So you just can't just put an action plan in place and just leave it for a few weeks and hoping that it all goes according to plan and everything is fine. That's not going to work. So you've got to follow up on a day-to-day basis, make sure that the action plans that you've designed and developed to resolve the situation have been put in place. Because what it is they give you a certain time period. It could be a few weeks. They will not, and they will come back, and they'll come back to check on those compliance orders, if you have any, and to see if you've done what you said you were going to do. And they will not just be asking you. They'll be asking for the documentation to show that you did it, and they will be checking with the staff as well to ensure it was done. So the whole process of the findings, is the summary information. It's the summary of their visit. Um, there's other parts to it that are involved, like the administrator of or the executive director for the home. But there's that they do this during an exit interview. Um, so the other thing I want to mention is when they when they do come back, they don't tell you when they're coming back. They give you a rough idea. So like I said, they'll say, "Oh, we'll be back, within a month," or something like that. But they don't necessarily give you a specific date of when they're gonna come back. Um, but anyway, I can't emphasize it enough to take it extremely serious, and really work on those action plans as very quick as possible. I'll give you an example, for myself. The exit interview was on a Friday, and when we got the findings, I met with the administrator. I took it upon myself to work on the action plans over the weekend, starting right away Friday night at home. So that was just the approach I took. I knew the things that had come up, explained to me by the administrator, and I took it upon myself to work on it right away. And I worked very well with the administrator, and we worked on it over the weekend. So I drafted it all up, and then I would send it to the administrator to review and to take a look at it. So it's very important that you take the process very seriously. If there's any compliance orders or anything like that, that you develop those action plans, and that you take it very seriously and work on that right away. Um, the only Just a few other things is, um, every home is going to be a little bit different. Um, I did it for within long-term care, a few long-term care homes, but um, the harder you work on the day-to-day stuff for infection control, for example, the better your program will be. The less likely anybody will find any issues within the home, and you'll have good results. So that's the approach that I took, and I think it was very effective. I can only recall there were many ministry visits, um, but there was only, I believe, for one time where there were a couple written notifications on a couple issues, and a CO that had to be the action plan had to be created for regarding masking, if I recall correctly. So, and it's over a number of years, that's an extremely good result. Not to have many written notifications or COs for infection prevention and control, because there's so many issues, so many areas that they can look at, and they can go around and interview staff about, right? So if you, and I won't go through them all, but there's easily, just for hand hygiene alone, they can look at hand hygiene during dining service, when snacks are being given out, hand hygiene, during medication passes, hand hygiene during any interaction with the residents. So before and after any contact, before you go into a resident's room, after you leave a resident's room, donning a doffing. So there's so many IPAC issues, surveillance they can be looking at. Um, so if you're able to get through like an inspection and get it, um, everything is good from 3 or 4 inspectors that have been at your home for multiple days, that's that's pretty amazing, because that's a lot of people on the floor looking at IPAC, for example, and it's it could be so easy for them to find things. So the harder you work on building that infection prevention and control culture, the better program you will have. You'll have staff that are very proactive day to day, working on things to make things better. Um, and you're going to be much more less likely to have any issues with the ministry inspection regarding them doing their anything dealing with their inspections, but any issues with like written notifications or compliance orders, that's going to be much less likely. So if you build that into your culture of having a really good program, you're not gonna see those issues happening. So it's just kind of to wrap things up a bit. Today's episode is episode 7, so we're focused on compliance and inspections for this episode. So, it's kind of think about everything I talked about during today. There's a lot to it within this episode, but and kind of takeaway message from it, and I kind of said it a few times, but I'm going to say it once more before finishing up the episode, is, really just not only design a really good infection prevention and control program, but build that culture, so staff are very proactive with all their IPAC measures, and then uh, the inspections from the ministry will go pretty smoothly. Okay, because your staff are going to be very informed. They're going to be able to answer all those questions that the ministry staff inspectors are going to ask them, and you'll be in a very good position. If you don't do that and you don't work on that, then you're really putting um, the home at risk with these inspections, because they're much more likely going to end up with the written notifications and the COs. And then just the last point I want to make, I mentioned earlier, is just relax. I'm not saying you're going to enjoy the process or anything like that, but you need to be relaxed going through these inspections. Answer the attend these interviews in a timely manner, answer their questions, get the documentation to the inspectors as fast as possible. I already mentioned about introducing yourself to the inspectors and start building that relationship with them. All inspectors, anybody that comes into home to do inspections, do a little touch point with them. And things will go a lot smoother during the process for the home. So, um, and then the last thing, which wrap up, is um, just don't panic. Like I said, that's not going to help anything, right? So just take it easy, relax, and do everything you can to meet answer the questions from the inspector. So, thank you very much for listening to episode 7 uh, for the Control Exchange podcast. Please take some time to subscribe, forward the podcast links to within your network, and help me build the audience base for this podcast. Thank you very much.